Hi there, thanks for joining me for my brief presentation about the impact of the COVID-19 pandemic on nurses' mental health. These are the findings from my rapid review and observational comparison. My name is Diane Trudgill, and I'm a social worker and a PhD student in the School of Social Work at the University of Windsor in Canada. Just a brief agenda, we'll go through a brief introduction. I'll talk about the methods of this project, the findings, the implications, and then I'll give a few recommendations. So just to introduce the topic, acute care nurses, which are hospital nurses, frequently encounter stressors at work. Some of these stressors include insufficient beds or rooms for patients, traumatic death of their patients, and often they experience verbal and physical abuse, both from patients and patient families. These problems have been long-standing and are not new. However, during the COVID pandemic, new problems also emerged in addition to the existing issues that they were already facing. So some of the new problems that emerged were inadequate medical or personal protective equipment and inadequate staffing. So the nurse to patient ratios were not sufficient. The methods for this rapid review is currently in progress. So these are my preliminary findings, and I will continue to add further research and develop additional findings. The findings that I'm going to present to you today are just based on the search of one database, which is the CINAHL Complete database. And I used the search terms anxiety or depression or post-traumatic stress disorder and nurse or nurses or nursing. And I looked for articles which had prevalence estimates of anxiety, depression, and or post-traumatic stress disorder. And then I completed a pooled prevalence analysis. So the findings include 29 studies are included in this review. All of the studies included have had prevalence of at least one of anxiety, depression, or PTSD. So there were 27 studies about anxiety, 22 about depression, and 8 about PTSD. There was representation from several countries, as you can see listed here. China was the biggest contributor with 12 studies, and Turkey with 4. So this is just a table of all of the studies that were included, and you can see the citation on the left column, and then anxiety. So for example, in the top row, anxiety, it says 629 divided by 1,265. So that means that there were 1,265 participants in the study, and 629 of them had anxiety. So I completed all of the studies like this for anxiety, depression, and PTSD, just reporting exactly what each study reported, and then calculated a pooled prevalence at the bottom, where you can see the row about the total. So the findings here, the findings of the pandemic pooled prevalence. So we have anxiety at 41.2%, depression was also 41.2%, and post-traumatic stress 30%. So those are very, very significant numbers of nurses who are experiencing these mental health conditions. So then I looked through the literature to find some similar research from pre-pandemic times. So I did find one systematic review by Naushad et al. From 2019. So they completed a systematic review of the impact of disasters on mental health of medical responders. So this did include nurses, physicians, and other health professionals. And they were all about public health disasters, natural disasters, and man-made disasters. So this is not just a typical pre-pandemic times, but is related to other disasters. So you may expect that the mental health conditions might be similar to COVID times. So they calculated theirs a little bit differently. They used means to report each of the mental health conditions. So they reported anxiety prevalence of 36.8, depression 23.8, and post-traumatic stress as 20.5%. So just to have a side-by-side comparison, here we have on the left pre-pandemic, but still disaster related, anxiety to be 36.8. And then on the right side, you see during the COVID pandemic, 41.2. So those ones are fairly similar, but then depression pre-pandemic 23.8 and during COVID pandemic 41.2, and then post-traumatic stress 20.5 versus 30 during the COVID pandemic. So the implications, why does this matter? I mean, nurses are a vital component to our medical system here in Canada and all over the world. They are the front line in hospitals doing a lot of the hands-on work. Mental ill health may impact the nurses both at home and at work. And the impact of poor mental health at work can have really serious consequences when we consider that nurses provide medication and are giving injections and are responsible for a lot of hands-on caregiving. So poor mental health among nurses may cause even greater staffing problems, as more nurses may be taking sick leaves or may leave the field entirely if they are just really burnt out. So a few recommendations, primarily for future research. So I do believe that we need more targeted research, in particular about acute care nurses, hospital nurses in particular. There was not a lot of research out of North America during the pandemic, and so it will be really great to get some North American research, as well as some longitudinal research where we're looking at different time points with the same group of nurses. Particularly, I think it will be important to see how their mental health outcomes change over time now that the pandemic is winding down, and hopefully we've seen the worst of it. Additionally, some systematic reviews of mental health outcomes at different time points during the pandemic. So looking at research that was already out there, but looking at early in the pandemic versus maybe mid-pandemic, and then again towards the end, and comparing how things changed over time. And that is the end of my presentation. I hope that you enjoyed it. I do look forward to connecting with you if you would like to chat with me, get any information, or if you need any of my references, please feel free to reach out at my email address here, and I would be happy to hear from you.